So now you've submitted your paper, and perhaps you've been just so good or really lucky that you didn't have any, that it was accepted and you didn't have any revisions. But, but that is very not often the case. So I'm just going to talk with you a little bit about my experiences with what you do when you get your paper back and you need to do revisions. And first I just wanted to give you a little bit of information about the two particular partnerships in the work. A little bit dark up there, but these are some pictures of my community partner, Reverend Kearney. But the first project is the one I mentioned when I introduced myself, that I started out in this work by getting involved in the Greensboro Health Disparities Collaborative. They wanted to do a project looking at what sort of the differences were in perceptions of personalized medicine between African American and white participants, particularly those people who are already taking prescription medications. So we did 2 focus groups with African American participants and 2 with white participants. It was all qualitative research to really hone in on what the difference in perceptions were about, you know, your genetic information, how that could be used to develop medications to treat different diseases. So this partnership had been around for a long time, as you've heard, and it was an interesting process coming into it as a postdoc. These folks have mentioned already Nettie Code as one of the matriarchs of that partnership, and she certainly sort of put me through my paces as I came into the partnership to make sure that I was really there to help and that I was in it to be a partner. So, but she eventually was hugging me and things like that, and Jennifer was instrumental in letting Nettie know that I was there to help and be a partner. So it was a fantastic learning experience. And then another partnership that I've been able to develop myself, and it started from, there was a whole partnership between Shaw University, UNC, and 20 African American churches throughout the state. And I was working with them and got partnered particularly with one church because I do food systems research, and they were out in a rural community that had 50 acres of land. They'd started a community garden, and they were really interested in seeing what the impacts of the community, of their church garden, were on their participants, so their adult and youth participants in that project. And they came to us at the Center for Health Promotion and Disease Prevention to help them figure out how we would measure that, what sort of intervention we could do with the garden, and then what sort of pre and post testing we could do to measure both impacts on fruit and vegetable consumption and attitudes about trying different foods, but also something that they were particularly interested in, whether working in a garden and being able to choose what you plant, what you do with the food, would empower participants to feel like they could be more in charge of their life in general. So we help them figure out how you actually measure that sort of thing. All right, so for both of these, for the respectful prescribing paper, which was those qualitative focus groups with African American and white participants, we chose to submit that together to the Public Health Genomics, which was the journal we found to just be the most appropriate for looking at genetics in sort of a public health setting. But it was an international journal, pretty science-based things that they published. For our Harvest of Hope, that's what our garden project was called, we submitted our first publication to the Journal of Progress in Health Partnerships, which is a journal run out of Hawkins that really wants articles that are partnered in the writing and talk about partnerships. So you could imagine there are some differences there in the types of reviews that we got for our papers. We got revise and resubmits on both of these papers. And so one thing that I wanted to touch on here is that it's really important to prepare your partners for what reviews are coming in. What it means that there might be between 2 and 4 reviews coming in. They could be contradictory. They could have completely misunderstood partner research. They could have misunderstood other parts of your study. They could be harsh. They could be tactless. So for both of these projects, I let my partners know sort of what to expect when I sent on the reviews. And as I mentioned, the journal about the partnerships, that journal was good reviews. Nothing was contradictory. It was all just stuff that could really help us improve the paper. The public health genomics paper had a lot of confusion, more about our methods than about our partnership. But they wanted to know about what our sample calculations were, if we'd done a power calculation to do our focus groups. They wanted to know if we could turn our qualitative results into quantitative results. So there was a lot. No, it's interesting as we worked on crafting how we would respond to these reviewers that, of course, there are things that we did take and they were helpful and we used them, but for those 3 particular comments that came from different reviewers, we had graciously explained why we weren't going to make those changes. So for both of these, we worked together to look at what the comments were, talked either face-to-face or through email to decide how we wanted to respond if we did want to respond to some of them. For the respectful prescribing, I did a lot of actual editing once we had decided what changes we were going to make, and also drafted that response to the reviewers. And then it went around to the other co-authors to approve that process, and that went back in. The paper was accepted and it's been printed. Excellent, that's great. So the other paper, the Harvest of Hope paper, we had fewer authors. It's a newer partnership, so there are less people sort of to go through. So we met and talked, and then what I actually did is went into the paper and made comments where I wanted my partner, that's Reverend Kearney, who are presenting at APHA there about our work. I just put in notes where we talked about for him to go in and make changes so he could find them, so to help him navigate the paper. He went in, he made his changes. We talked about our how we would respond. We reviewed all that. We had a research assistant, a doctoral student, Tasha Smith, who was helping us with that as well. So she did a lot of the editing. We just went through, reviewed it together, and submitted it back in. And that one's now been accepted as well. So the last thing, I think a lot of us, when we get to the galley proofs, we're like, phew, that means we're about to be published. There's not much work left to do. And generally that's true, but I would suggest some sort of guidelines. One is make sure that you have more than one person proof them. And then I just made the note here, check that all authors are included. And I'll tell you a story about that in a minute, Carrie.
I don't know what a galley is.
Oh, sorry. It's just a mock-up of what it will actually look like when it's published. And you need to go through and make sure that it is what you thought it was going to be. Alex and I have a paper that went in, and I don't know how we missed it. We're not sure what happened, but a very important word is left out of the title.
Transforming. Rather important for what we were talking about.
So it's just out there without that word. And that's just how it is. The other thing, the paper that I wrote with Jennifer with our respectful prescribing, and to my mortification when it came back, and this was after the galley proofs, I was the only author on the paper. Yes, you can imagine. This is the first partnered paper I'd written. I was working so hard to be a good partner, and then it comes out just fine.
On the galleys.
Yeah, no.
Oh.
On the publication. On the publication.
Were all the authors on the galley?
Yes, I thought so. Something was lost in translation, maybe because it was an international journal, maybe because I was just a neophyte at that point. So I immediately contacted the journal, told them that it needed to be fixed. We got a quick addendum, and it's been changed online, and they've already printed it, so they can't fix that part. I immediately let my partners know what had happened and how we were working to rectify it. But it's a good example of having multiple people perhaps review the
galleys. Yeah, and I find that community partners are even better looking at proofs and approving the galleys because they have a much better eye than I do.
And I would just emphasize how Molly handled that was perfect because she immediately dealt with it. And she immediately contacted us, apologized for the mistake, and explained what she'd done about it, and that the correction was being done online. So she she didn't just let it sit there. She dealt with it, and she came back to us. And, you know, I think that's the best way to handle that kind of situation, because mistakes happen. And
Jennifer's still talking to me.
I'm still talking to her. And just, you know, coming forward and just being clear about it, I think is the best way to handle it.